All right. Thank you for that wonderful introduction. You are amazing.
Thank you.
I'm so proud of my nurses and all my employees. We have a great facility here. And we're all women, and we know what women want and what they're going through. And it's, sometimes it's uncomfortable, but we're going to help. We're going to help everyone. Just knowledge is power. And so you're going to get some knowledge today. So what is women's wellness? We're going to talk about women's wellness. Women's wellness is taking care of ourselves, talking about the issues we have with our friends, our family. Sometimes we talk about it. We don't know that there are things to do about it. There are some things. There are some answers. So we're going to go through all that. So sometimes, we as women need to take care of ourselves. And we're so far down on the list, we don't even make the front page. We're on the second page, and we never get to the second page, where moms and wives and workers, employees, and daughters, and everyone else comes first. We're going to put ourselves first today. So, what is it? What are we talking about? We're talking about vaginal health, the skin of our vaginal area. As a dermatologist, board certified, I'm an expert in skin. We take care of skin all over the body, head to toe. And there are some issues that can happen as we age, as we have children, as we have multiple childbirths, or we have menopause, we go through breast cancer, or we can't take hormones, or we decide not to take hormones. All of these things affect us. So I'm going to go through all those. So a couple of different procedures that I'm going to talk about today. The first one is radio frequency. Radio frequency, we deliver heat to the skin on the vaginal area. What does that do? Heat stimulates collagen production, and it also stimulates elastin. And those things we lose as we age. So that helps with multiple issues, which I'll go through. And then the other treatment that we have, or a procedure that we can do, is called V-tone. What is V-tone? V-tone helps with, have you ever heard of Kegel exercises? I have. Did I do them? Not much. This one is like Kegel exercises on steroids, and you just have to lay there and the machine does the work. I like exercising like that. So we're going to talk about that too. So these are two different procedures that can be done for various issues. All right. So lots of people on here. Good to see y'all. First thing we're going to do, okay, so why? Why would we need to do this? Well, okay, so we have childbirth. I know I've had multiple children, 3 to be exact. And in my 30s, I experienced some incontinence. What the heck? I was on a trampoline. I'm like, what is going on here? I had no idea. Well, stress incontinence. Things get lax down there. And so that can happen. 30% of women in their 30s. 30%, you're not alone. I had it. Laugh, cough, sneeze. I mean, have you heard the term laugh till you get pee in your pants? I mean, we don't want that. We want to laugh. Thank you, God, you have a sense of humor. But we don't want that. So in my 30s, I had some stress incontinence and jumped on that trampoline. We had a trampoline in our backyard. I love jumping on the trampoline. So I had to start wearing a little pad. Well, if you start with a mini, you may end up with a maxi if you don't do anything about it. So we want to take care of these things and help with these issues when they first get started. So that's something that happens. And you get laxity. Sometimes during childbirth, you have a little tear in the introitus in your vaginal opening. And that tear is known, you have to have an episiotomy where they stitch it up. That leaves a scar. And scar tissue, it's not normal healthy skin, and it's not as strong. So it can tear, and it can lead to painful intercourse or intimacy. So it helps with that. Really helps with that. I help with scars all over the body, on the face, on the body. In the vaginal area, it's the same thing. It's the same process. And then that's usually, in our 30s, that's an issue. Sometimes it can be in our 20s, depending on when you start having children. In our 40s, okay, well, this is something else that happened to me. So in our 40s, a lot of women start having perimenopausal symptoms. For me, 38 years old, 38. It can happen when you're young. I didn't realize what was happening. 38, it was happening. And lab tests confirmed it. And so I wasn't going crazy. It was menopause. But usually it's in your 40s or 50s. But menopause, perimenopausal symptoms. What happens? Our estrogen level decreases. Estrogen is essential for skin health. So our skin in the vaginal area becomes thinner. It becomes more susceptible to tearing. It has decreased elastin, and that lack of elasticity contributes to tearing. So the dryness, the irritation, if you have irritation in that area, the intimacy is not going to be as good. It's not going to be as pleasurable. So we want to address that also. Some people either choose not to do hormone replacement, or they can't do hormone replacement because of breast cancer. This is the ideal treatment for that. If you're not going to be able to take hormones, let's get your skin healthy by introducing heat and the collagen, increase the collagen and increase the elastin of your skin. Perfect treatment for that. As well as the incontinence that comes with age and some of the other issues. And then 50s, again, perimenopausal. And there's some other issues that can happen. Sometimes, well, a lot of times these days, that the semaglutide, that's a big market right now. Ozempic is a semaglutide. That can really have an impact on your weight. And if you lose a lot of weight, everything becomes lax. You don't only see it in your face. You see it all over. And in your vaginal area, you can have a lot of laxity there. So this helps with that too. There are a lot of different issues that can be helped. So, and then, where do we do it? We do it externally in the vaginal area, internally also. And it's pretty easy. It's a really easy procedure. I know when I had mine done, I did it before work, before a full patient load one day, earlier in the morning, had it done, and I'll go through what we do and how we do it. And by the way, we're the first in Baton Rouge and the surrounding area to have this. First and the best. So there you go. So when I do mine in the morning before I see patients, and I'm comfortable, I do topical numbing, and then we have the option to do nitrous oxide, which is laughing gas, Pronox. Some people know that trade name, Pronox, and it makes it exceedingly comfortable. And if anybody knows me, I'm a wimp. I am a wimp. The definition of wimp, me, Dr. Z. I cannot tolerate pain whatsoever. This was easily tolerated. So very nice. And I just worked all day. I had a little fullness. It felt a little bit swollen. Mild discomfort when I sat down, but nothing. It was really like 1 out of 10, maybe 2 out of 10 for 24 hours. That was it. Most people, it's 24 hours. And also, it takes so you come in the office. Number one, you have a consultation. We make sure you're not having any issues to start with, any infection, and you've had a pap smear recently, and you're all good to go. And then when you come in for your treatment, again, private room, private bathroom, very comfortable, and we apply topical numbing for about 30 minutes. And then we start with the procedure, depending on which one you have or both. Both together, you get the best results. And both meaning the radiofrequency handpiece device that applies heat, stimulates the collagen and elastin, and then the V-tone handpiece, which stimulates the vaginal pelvic floor muscles. So it's basically Kegel exercises on steroids. So both of those things together help rejuvenate the whole area. So you come in, we put the numbing on, we give you the Pronox if you would like it, and it takes about 30 minutes for the procedure, start to finish. Very comfortable. You can go to work, you can do whatever you want to. There are a few things that you don't do. You're not going to go in a hot tub or soak in a tub for a few days afterwards. And usually you do one treatment a month for 3 months, maybe 6 months. It depends. It depends on how young you are, how long you've been having your issues. If you're in your late 50s and you haven't had estrogen in your system because you went through menopause 10 years ago, you may need more treatments. It may be 6. After your initial series, then you would go to a maintenance. And that would be like one every 6 to 12 months. Again, everyone being different. So it's pretty easy, the maintenance. Like downtime, none. Like I said, I went straight to work that day I did it. Everyone's different. One person had drainage, discharge, a little bit of light discharge where you have to wear a pad for one day. I had it for 7 days. Again, the normal is 3 to 5 days. Nothing. It's really easy. And you wouldn't want to have any mechanical stimulation for about a week, no intercourse, for about 1 week afterwards. So that's a lot of the information, and we're going to answer some questions. And then after the treatment, we have a topical product that helps heal faster, and it's a carboxy gel. We actually use this on the face after laser treatments. It's beautiful. You just heal in half the time. But some people won't even need this because you heal in a day anyway. But some people who have thinner skin may have a little more swelling or discomfort, and this would be good for that. Thank you. And I think I'm going to answer some questions.
Okay.
Hey, everyone. So the cost varies depending on how many treatments you have, if you have a package or not, but depending on the handpiece and what you have done, but it can be $300 to $1,200 for the treatment. So all of that's different, and it varies depending on the package you buy.
Ask them to send in their questions.
So y'all send in your questions if you have any. I know you have some, but we all have some. So here we go. This is the platform, and I'm going to show you. This is one of the hand pieces we use, and this is the one for V-Tone. So V-Tone, it's electromagnetic stimulation. So it stimulates your muscles, and I said it was like Kegel exercises on steroids. It's awesome. And this is what's inserted, and it just stays in there for about 20 minutes, and you're just constantly doing exercises on steroids, and it strengthens those muscles, and those muscles help with incontinence, and it helps with laxity. That's what we want.
Dr. Z, someone's asking how long is the session?
How long is the session? Like I said, it lasts about 30 minutes in preparation. To finish, you may be here 45 minutes to an hour, but that's it. Max an hour. Again, you're very comfortable. It's women taking care of women. We understand the anxiety, sometimes the fear. We make you comfortable. I know as a physician, I'm still a woman, and when I got my treatment, I had a little anxiety. Here I am for God and everyone to see. But we all want the same thing. We want to be our best. We want to be our healthiest, and we understand that. So we make you comfortable.
Hey, Dr. Z, we have another question. Someone's asking about the difference between using a radio frequency device versus something like a CO2 laser device or Mona Lisa, that kind of thing.
Yeah. So CO2 is wonderful. I love CO2 lasers. I have 2 of them myself. For the downtime and the amount of treatments and the variability that I can use, that I can do externally as well as internally, I chose this machine. Again, I have 2 other CO2s. One of them has the capability to do this. I think for me and my patients, I go with the radio frequency. Again, the downtime, the ease, the external treatment that I can give, I think it's better. I mean, some people may like the CO2. Everyone's different. For me, I go with the radio frequency. And this is the handpiece for the vaginal area, externally and internally. And there's a little tip here. And this tip is what provides the heat. So we do the entire area, inside, outside, all over. And then if you're having a specific area that needs more addressing, such as the episiotomy area where you have a little scar, or some people have what's a little scarring on the outside that can happen called lichen sclerosis. We're going to pay more attention to that. Again, we're skin experts, dermatologists. We know skin. We know how to treat it. Maybe not just with the laser. We may do a little something else, but everyone's individual. I will look at it, and we will formulate your game plan.
Another question, Dr. Z.
Yeah, another question.
For postpartum mamas who wants to know when can they start?
3 months after you have delivered. 3 months, and it's great because you're having a lot of issues at that point in time. It's really about a year until you get back to your normal self. I know it was for me. So starting at 3 months just gets you back there faster where you want to be. So 3 months.
And another question too, Dr. Z, is women who have C-sections, they still might need this too because of the urinary incontinence too.
Well, that was me. I had 3 children, and 2 of them were C-sections. Thank you, Ethan, for your footling breech delivery, but absolutely. Again, everything still gets stretched out. Even though that head does not come through the vaginal canal, it still stretches everything out. Believe me. What else? Other questions?
Yeah, there was another question about how hot does the machine get? Can you feel the sensation of the heat inside?
You know, most people know. I didn't feel any. And that's due to the numbing. And it's very comfortable. And so we just make sure all the areas are numb. You know, I always talk to my patients and ask them questions, and people who have had other treatments done, and sometimes they don't numb all the area, or they don't numb internally. What the heck? I mean, this is not torture. It's supposed to be comfortable. So we make sure everything is numb. Believe me. Again, WIMP, I don't want my patients to experience pain. I don't want to experience pain. So no, you really don't have the sensation of heat. Maybe after the treatment, after the numbing has worn off, then you may have a little warm sensation. That's just from the increased blood flow in the area. Yeah.
Someone asked, does it help with painful intercourse for menopause?
Well, definitely, because so the question was, does it help with painful intercourse with menopause, after menopause, after you've been through menopause? Well, yes, because you get vaginal dryness with menopause. You get thinning of the skin because you don't have as much estrogen to maintain your skin. And so decrease collagen, decrease elastin. Those things with menopause contribute to irritation. That irritation decreases the pleasure during intimacy, right? If you have an irritation, it's not as comfortable. Mm-hmm. So yes, for those reasons, you have increased moisture production, increased collagen, increased elastin. All of those reasons make it more comfortable. So definitely. Good question.
Do you want to tell them about our event on Wednesday?
Oh, yeah. So on Wednesday, March 6th, 2 days from now, we're having a women's wellness event. And so introductory pricing for the machines and the treatments, and we'll have evaluations. You want to come in, we'll have an RN, I have 3 RNs, and an LPN on staff. So we have the best of the best, most comfortable environment. We'll make you comfortable. And feel free to call, actually ask questions, or schedule an appointment. Come by and visit. And we have a couple more questions that are coming through, and we're going to have a giveaway at the end, secret. We're not going to announce the winner on live, but we will direct message you. So we'll let you know as soon as. So y'all ask your questions. You have any.
Did you mention that the machine also has for face and body?
Oh, yeah. So the machine, this is one of my favorite procedures. Heat stimulates collagen. This is for your face and body too. So this is my go-to. Every 3 months, I do a Morpheus on my face, neck, and chest. That's what I do to maintain my skin. And I'm 58, and I'm fighting it. Thank you, God, for the birthdays. But we still want to look our best. It doesn't matter how old we are. I have my oldest patients, and I have 2 of them, 95. We all want to look our best. Doesn't matter our age. We want to look our best. And this treatment also is great for our body. So I do my abdomen, for that lax skin. I help tighten it. I do my knees, above my knees. Those wrinkles on your knees that we don't want as much. It's great. And I actually do my arms too. You can do the backs of your hands. Any area where you're having lax skin, you want to stimulate collagen. That's what you do. It's great. All right. I think I have a name here. Let's see. Yep. Okay. So we're going to direct message you. Check right now, pretty soon. In the next few minutes, we will direct message you. And you win a V8, Morpheus V8, and a V-Tone. And the V-Tone is what helps strengthen those muscles. That's the Kegel exercises on steroids. And then the V8, external and internal, helps with the rejuvenation process. So check your messages. Anything else? All right. Wonderful. Thank you for joining. Have a great day. And call us or message us if you have any other questions. Dr. Z out.